Welcome back to another episode of Am I Mental? Doctors in Court Edition. I'm your host, Dr. Sabine Fonderson. And in today's episode, I'll take a closer look at a case involving a medical professional in the insurance field. We're going to talk about the importance of medical accuracy, the responsibility we have as doctors to ensure our reports are thorough, and the legal consequences of missing key details. In this case, I'll be discussing an insurance physician's mistake during a disability reassessment, how it affected the claimant, and what the court decided. But before I get started, I want to let you know why we're using anonymous names. It's important to respect the privacy of those involved in these cases. And by using fake names, I ensure we maintain confidentiality while still delivering an educational discussion. And today I'll be referring to the claimant as Mr. Smith and to the doctor as Dr. Roberts. Let's get to the timeline of events to understand the case better. In 1982, Mr. Smith starts receiving benefits under the Dutch Disability Insurance Law, the WAO, due to severe headaches, back pain, and leg pain, which left him with an 80 to 100% disability rating. In November of 2002, during a reassessment, Mr. Smith was declared 100% fit to work. However, Mr. Smith didn't agree with this assessment and filed an objection. 2 years later, after another reassessment, Mr. Smith's disability rating was restored to 80 to 100% and he received his full disability benefits again. In April of 2007, Mr. Smith was called for another disability assessment. This time he was assessed by Dr. Roberts, an insurance physician working with the Dutch Employee Insurance Agency, or the UWV. However, there was an issue. Dr. Roberts didn't perform a physical examination. He also didn't have all the necessary medical records available because of a technical issue with the computer system. Several months later, in October of 2007, after that assessment, Dr. Roberts prepared his report, but it was based on outdated medical information between 2002 and 2004, and it wasn't reflecting Mr. Smith's current medical status. In November of 2007, Mr. Smith received a preliminary notice that his disability benefits would be fully terminated and declaring him fit for work. A year later, in 2008, Mr. Smith's lawyer challenged this decision, and further medical investigations revealed that Mr. Smith had a rare spinal tumor. This was the actual cause of his pain and disability, a condition that was not identified earlier. And Mr. Smith underwent surgery in Germany to treat the tumor. Now, let me take a moment to discuss a couple of important medical terms from this case. Spinal stenosis, this is a condition where the spaces between the spine narrows, putting pressure on the nerves. And this can cause pain, numbness, and other neurological issues, which was the underlying cause of Mr. Smith's complaint. Lipomatose. This refers to the growth of fatty tumors around the spinal cord. It's a rare condition and can contribute to conditions like spinal stenosis. This was eventually diagnosed as the cause of Mr. Smith's ongoing issues. Let me get back to the core of the case. Dr. Roberts, who was the insurance physician, his job was to assess whether Mr. Smith's current condition was disabling enough to maintain his benefits. But there were some problems with his report. First off, Dr. Roberts failed to conduct a physical examination of Mr. Smith during the 2007 assessment. He also didn't have access to Mr. Smith's full medical records due to a technical issue, which meant he was unaware of critical information regarding Mr. Smith's ongoing treatments and symptoms. Instead, Dr. Roberts based his report largely on outdated information, including medical data from 2002 and 2004, and he didn't account for Mr. Smith's worsening condition. And this led to the conclusion that Mr. Smith was fit for work even though he had a rare spinal tumor causing his symptoms. There's a question I've been thinking about. As doctors, how do we ensure that our assessments and reports are not only accurate but up to date? Dr. Roberts based his decisions on outdated data, which obviously affected Mr. Smith's case. And how much does a lack of access to current medical records impact the accuracy of our evaluations, and how can we mitigate that risk in practice? In my experience, I've worked before as an insurance physician, and it's really important to ask patients whether or not the information they give to you at that moment is accurate. And if it's not accurate, it's not uncommon for doctors that work as insurance physicians to request information from other specialists. In my case now, as a general practitioner, I've received many requests from insurance physicians asking me to write a small summary of current medical issues, and it's something that the patient is also partly responsible for, and they also need to make sure that their medical records are as updated as possible. Now, maybe Mr. Smith was not aware he could do this, but Dr. Roberts, as an insurance physician, should have made sure that the information on Mr. Smith was as accurate as possible, and contacting specialists or general practitioners would have been the right path to take. After Mr. Smith challenged the decision and further medical investigations confirmed the presence of a spinal tumor, the case eventually went to court. Mr. Smith filed a complaint against Dr. Roberts for the incomplete and inaccurate assessment, and the court found that Dr. Roberts had indeed failed in his duty to properly assess Mr. Smith's condition, especially considering that he had not performed a physical exam and had used outdated medical records. And despite the serious nature of Dr. Roberts' error, the court ruled that a warning would be the only appropriate measure. The court found that Dr. Roberts had acted with carelessness in his assessment, but did not believe the mistake had directly influenced the final decision regarding Mr. Smith's disability status, as further investigations led to the correct diagnosis. Let me take a look at the evidence. The main issue was that Dr. Roberts failed to perform a proper assessment, and he did not use current medical information. And the court noted that Dr. Roberts had access to Mr. Smith's medical history, but chose not to update his records before making the assessment. And the court also noted that the failure to conduct a physical examination was a significant oversight. However, the court acknowledged that Mr. Smith's medical condition was eventually discovered through further testing and surgery. The court concluded that while Dr. Roberts' actions were substandard, the error did not result in an unjust decision, and therefore the penalty would be a warning rather than a more severe sanction. To sum it up, this case highlights the importance of accuracy, thoroughness, and up-to-date information in medical practice. Whether we're treating patients directly or offering expert opinions, it's crucial that we always ensure our assessments are based on the most current and comprehensive data available. And Dr. Roberts made a mistake, but the court's decision to issue a warning rather than a harsher penalty serves as a reminder that mistakes are a part of medicine, but we must always strive to learn and improve from them. It's also important to tell patients that they are also partially responsible to providing that kind of information that's needed to make a good assessment and write a report. Thank you for listening to today's episode of the Am I Mental podcast, Doctors in Court edition. I hope you found this case informative and insightful. If you enjoyed the episode, please subscribe and don't forget to leave a comment with your thoughts. I'd love to hear from you about how we can continue improving the accuracy of our assessments as medical professionals. And stay tuned for more episodes where I break down real cases and lessons we can learn from them. See you next time, and continue to do what you love.